We are back with yet another episode of BMC Global Live AlHilal Health World, Nothing But Lifestyle. I am Jessila Mujib. In this talk show, we bring before you an expert doctor from AlHilal Hospital to address your various health issues. Low back pain is a common cause of concern for a lot of us these days. It restricts our body movements and also hampers our daily life activities. To discuss this topic in detail, we have with us Dr. Mathew Philips from AlHilal Hospital, Sitra. He is an orthopedic surgeon with an experience of 15 years and his area of expertise includes sports, injuries and also trauma management. So doctor, welcome to the show.
Thank you, Jessie.
Thank you for being with us today.
Thank you for your nice words.
Thank you.
Let's begin.
Yeah. So doctor, let's begin with discussing what's the root cause of low back pain.
Okay. Thank you, Jessila. As you mentioned before, low back pain is a very common problem among the whole population. I can say almost everyone will be affected with back pain in their life once or twice. So we classify back pain as acute back pain, subacute back pain and chronic back pain. When we call it acute, when it occurs suddenly and it lasts for maybe within 4 weeks. Subacute from 4 to 12 weeks, and chronic back pain if the back pain has been affecting the person for more than 12 weeks or at least 3 months. If it is more than 3 months, we call it chronic back pain. So in these, the acute back pain and the subacute back pain are the most common forms of back pain we encounter in many patients, and the common causes for it include the muscle sprains and the joint sprains. So these are fairly common things, and anybody can encounter it during their normal lifestyle. And these are the most common kind of back pain. Next cause of back pain is due to degeneration of the spinal column. Just like any other tissue in the body, as we age, as the normal part of aging process, some degenerative changes can happen here. And when this process affects your intervertebral disc, as you know, the spine is not a single bone but a collection of 33 bones which are stacked on top of each other, and they have these intervertebral discs in between, which are soft structures which will help cushion the bone and transmit the waves or the pressure waves or the shock waves along the spine and support the spine in a certain way. So this can undergo degeneration and can protrude or cause compression of the nerves, which can lead to pain. Another cause of back pain is inflammatory conditions, where your body responds to various stimuli or overactivity or any problem which affects the joints. The body will respond by producing an inflammatory change. Basically, it is swelling and increased vascularity in that area. So such kind of pain we call as inflammatory pains, and such diseases are called arthritis. Arthritis of the spine can cause pain. So different kinds of arthritis is there. When the joint is degenerated, it is called osteoarthritis, or some other pathology which affects the joint like rheumatoid arthritis can lead to back pain. And there are categories of arthritis which can affect the spine, which are known as spondyloarthropathies. Another kind of back pain is due to the weakness in the bone, which we call as osteoporosis. So this is more common in ladies, especially past the menopause, past 50 years of age. Sometimes males can also develop osteoporosis. When the bones become weak, tiny microfractures can occur within the bone, which can lead to a painful response in the spine.
Okay.
So that weakness of the bone, and sometimes this weakness in the bone can be due to any other malignant process like tumors or any infection can also cause this. Other causes of back pain which are not related to the spine itself but can lead to back pain is pregnancy can lead to back pain due to the hormonal changes which affects the ligaments. So ligaments become more stretchable and that can lead to minor injuries and back pain during pregnancy. Then renal problems like a ureteric stone can cause back pain. Some infections like a herpes infection of herpes zoster can lead to back pain. They can present as back pain initially. Then as I mentioned, some malignancies can lead to back pain. So these are the common causes of low back pain that we encounter in our. Apart from this, trauma can, if you are involved in an accident or during sports or you fall down, that can injure the spinal column, and these injuries of the bone, muscles, ligaments all can lead to back pain. So these are the common causes of back pain.
So we know the pain is the main symptom. Any other symptoms associated with this condition?
Yes, as the name indicates, pain is the most common presenting symptom, but associated with pain, usually there will be muscle spasm, and that will present as inability to move, or you keep your spine in a certain position when you are unable to move. So that we call as spasm. And there is stiffness of the joints. If the joint is involved by some inflammatory process, such patients can have stiffness of the spine where you are not able to move your spine or not able to move around effectively. Another important symptom which we should be concerned about is the radiation of the pain. If the pain is not staying in the spine but passing down your leg and that, or passing to the front of your body or along the side of your leg. So these are the common areas where this pain, and this can indicate that there is some pressure on the nerve or there is some inflammation of the nerve. So this radiation of pain is an important symptom. Other symptoms are very severe pain which is affecting your sleep, and if your sleep is disturbed, you are not able to lie down properly. So such kind of pain is also to be a concern. So these are the associated symptoms.
Okay. So doctor, when should I visit a doctor with low back pain? Can I wait for some time?
Yes, as I mentioned before, the most common cause of back pain is a muscle strain or a joint sprain due to the ligaments. It can happen during our day-to-day activity, or if your work involves a lot of pushing and pulling or bending. So most of such pains, this is the most common cause, and most of these pains can be will go away on it. These are all self-limiting. Most of back pains are self-limiting, and most will go on its own. So depending on your discomfort, if you can tolerate the pain, if you can manage, especially if you are a young, physically fit adult person, you need not be concerned much. You can take a few days rest at home, and most of them are self-limiting. But there are certain things you should be careful about. Like I said before, even after taking rest, the pain is worsening or it is very severe in nature, and that is affecting your ability to move or function properly. That should be a cause of concern. If the pain is occurring at night and it is disturbing your sleep, then you should be concerned and visit. Then radiation of the pain. If the pain is radiating to your leg, that shows some nerve involvement. So that symptom should not be ignored, and that time you should visit a doctor. Then if you are past the age of 50, if you are a lady or a man, it is better to check your spine for degenerative changes, whether there is osteoporosis, whether there is any other condition serious condition which can lead to back pain. So those are more common in little more advanced age group. So if you are above the age of 50, you should not ignore even small pains. You should better consult a doctor at that stage.
Okay. So once we are recognized with the low back pain, what are the treatment options you would prefer?
Yeah, once a patient comes to a doctor with back pain, our first aim is to find out the cause of the back pain and to relieve the patient of his immediate symptoms. So this go hand in hand. In most cases, if we are pretty sure that there is no other underlying cause, we can start to give patient relief by giving him non-steroidal anti-inflammatory agents and muscle relaxant medicines. As I told earlier, muscle spasm can lead to pain, and pain can lead to further spasm. So muscle relaxants also form an important part of the initial management. Along with this, to provide more relief to the patient, we can involve the physiotherapy help. Physical therapy is a very important way of managing such pain, especially if you want to reduce the medical intake. If the patient is too much concerned, physical therapy is one where we use modalities like heat, cold, ultrasound, and it can be an effective way of managing. In some patients where we are concerned about any other problems, we might do imaging studies, especially the X-ray of the spine, where we can recognize any destructive lesions of the spine or osteoporosis, or whether there are any degenerative changes.
To rule out any
serious conditions. And also we can do a blood workup to rule out some common conditions. Can, like, especially if you are a diabetic, patient may not realize that he is a diabetic, and one of the common causes muscle pain, and that muscle pain can occur in your back. Not low backache per se, but it can also be. So a blood work is also essential, and certain infections need to be ruled out. So we can do a complete blood count. If the ESR is elevated, we have to suspect infections like tuberculosis. And also some malignant processes can be identified by blood workup. So these are the common. Then the next stage of investigation involves advanced imaging, when you are sure that there is nerve involvement, and like I said, the radiating pain, there is weakness of your legs, your bowel and bladder functions are affected. In such cases, we will advise an MRI scan also. So apart from the bone, we can see the discs, the nerves, the soft tissue, any inflammation there, any collection or abscess. All this can be well defined by an magnetic resonance scan of your spine. Most of the back pain can be managed without surgery. And with these measures which I mentioned, with medication, physical therapy, more than 90% of people will get relief from their back pain. Very rarely we require surgery, especially in advanced degeneration and where there is severe compression of the nerve which is causing weakness, or, as I said before, problems with your bowel and bladder, and severe pain also. If your pain lasts for more than 6, that is also an indication for doing surgery. If it lasts more than 6 to 8 weeks and it's affecting your life, then that is also, and along with the supporting evidence in the imaging or other studies, in such cases we might have to resort to surgery. And common surgeries involve the removing of the offending structure which is pressing on the nerve, which is most commonly a prolapsed disc, intervertebral disc prolapse. That is a very common cause of back pain with radiating pain to the leg. So in such cases, we will remove the offending structure, which is the prolapsed disc material, from pressing the nerve. In some patients, if there is advanced degeneration and the bone structure is altered, and it's pressing, we call that condition a lumbar canal stenosis or foraminal stenosis. In such cases, we may have to remove parts of the deformed bone to create more space for the nerves. In some cases, we have to address instability in the spine. If the spinal column is not stable, it can affect the nerves. So in such cases, we may have to fix segments of the spine, or we may have to replace the degenerated disc to restore mobility and stability to that spinal segment. So these are the common treatments which we employ in back pain.
Now you mentioned that surgery is rarely needed.
Yes.
So if one surgery is done, will it affect the mobility of the patient?
Yeah, it's a very big concern of people who
Yeah,
are
that's it.
suggested. They are afraid whether they will be able to live
after the
fully
surgery.
functional life, or whether they will be paralyzed or bedridden for a long time. So there is nothing like that. Few complications might rarely occur, but as I said before, spine is not a single bone. It is a chain of bones which are kind of interlinked. So even if we stabilize one area of the spine, the other areas are mobile, and that can, and fixing making the spine more stable in affected areas will in fact increase the capability of functioning for the other segments also. So patients need not unnecessarily worry about this overhyped complications and all. So I think there is nothing, and especially newer techniques of surgery where we can do minimally invasive surgery with very small incisions using microscopes, and this even fixation of the spine can be done in minimally invasive methods now. And instead of fusing the bone segments, now we have option of placing artificial discs, just like a joint replacement. So such new modalities of surgery, we need not fear such complications nowadays as much as before.
Okay. So doctor, any other condition in which low back pain is a major symptom?
Yes, as I said before, common condition in pregnant ladies, they can have back pain. In certain gynecological or pelvic pathologies like endometriosis, patients can get period related pain. In both sexes, if they have any urological related condition like a ureteric stone, that can present as back pain. And as I said earlier, some infections like herpes zoster can present as back pain. Certain vascular disorders like an aortic aneurysm can vary. These are all very rare conditions, we need not be concerned, but these are all non-orthopedic problems which can present as back pain. And such possibilities doctors do keep in mind depending on the age of the patient, the sex, and the other history from the patient. We can recognize these conditions and treat accordingly.
You mentioned earlier about the medicines. Now, what type of medicines you prefer, like painkillers? We are always aware that painkillers cause a lot of damage to the internal organs. So what type of medicines you prefer for?
Yes, that is a very good concern that you have raised now. See, when people refer to as painkillers, these are the class of drugs which we call as non-steroidal anti-inflammatory agents. So just like any other medicine, we know its effects, what it is going to do in your body. So as I said, that most of the pain is contributed by the inflammatory process. To reduce this process, we have to use medicines which control the enzymes which cause this inflammatory process. So people call these medicines painkillers because most common symptom of inflammation is pain. So it's just a way of general usage, and in social media and all, people have this fear of pain. But we need not.
Moreover, people have the habit of over-the-counter using painkillers.
Yes, you are right. That is also a concern because most of these medicines are available and people tend to misuse it.
Yes, yes.
So that is the point in which I want to concentrate, because misuse of the substance is not directly related to the risk. If you use it properly, there is no risk. We have years of research and evidence that these are safe to use if it is used properly. But misuse can lead to problems, and these problems are feared. So you don't have to fear if the medicine is prescribed in the correct dose, in the correct frequency, and the correct way to take it. If these are explained by the doctor and you take it properly, we need not fear any complication from this. Okay. So that is why we always say, if you are past the point of maybe more than a few days and you are compelled to take this medication, better go and get checked up and take these medicines properly as advised by the physician. Otherwise, we need not fear these medicines. It is just like any other medicine. It has its side effects, but if used properly, it is very effective, and the benefits always outweigh the risk of using the treatment.
Okay.
So I hope I am very clear about this.
Yes. Doctor, another common query is, can we prevent low back pain? What's your advice?
Yes, in the old age-old adage is that prevention is better than cure. Yes, back pain is the common back pains which we occur can be prevented to a certain extent. We cannot prevent it completely because, as I told, it is part of our human existence. We are a organism which walks on two legs. Our spine is all the gravity is acting on the spinal column. So everybody will have back pain once or twice in their lives, but you can reduce this influence by noting certain. First thing is maintaining your body weight. So obesity, and if you have excess weight, the whole weight has to be supported by your spinal column. This will lead to early degeneration. So evidence has shown that obesity is a leading cause of back pain. So try to maintain your weight. If you are overweight, try to bring your weight back to the optimum levels. You can get help from the nutritionist or from the doctor for this purpose. Second thing is fitness. Even as you age, the more you use your musculoskeletal system, especially your bones, the more you use it, the more stronger it becomes, and your muscles also, which help support the spinal column. So being physically fit is another way of, and to become physically fit, the best way is to do exercise. Exercise, very common exercise, just like walking, jogging, cycling, which helps to maintain your spine in a good position. That will help prevent back pains. Next thing is posture. When we stand or sit, if you have a very poor posture of the spine, that will put more pressure on your disc, lead to more degeneration. So maintaining good posture is very important, especially if your work involves standing or prolonged sitting. You have to use ergonomical ways or seats, or if you are standing, you have to maintain a good posture to prevent back pain. Next thing is from this previous sitting. Our current lifestyles are more sedentary, and more of our occupations are becoming online and dependent on computer systems, and where we are forced to sit in one place.
That's what I wanted to ask. People sit in front of the computers for a long time. What are your tips for them?
Tips for them is avoid sitting for a long time. That is the main tip. If you are forced to sit for more than a few hours, you have to take breaks, at least 30-40 minutes. You have to take breaks every 30 to 40 minutes. Take a 5-minute break, walk around, stand up, sit down. Maybe you stand up and sit down for a few times, or just if you can walk around for 5 minutes, that will be. Avoid prolonged sitting. Sitting is as dangerous as smoking, which is the next point I am coming to. Smoking is also it can damage your collagen, and it can weaken your nerves. So avoiding smoking is also a way to prevent back pains. So in short, these are the ways which we can prevent back pain.
Doctor, another problem is stress will affect all our lifestyle diseases.
Yes.
Is there any connection between stress and low back pain?
Yes, it has been proven that people who lead stressful lifestyles are more likely to develop back related problems, especially if you remember when I began, I said about chronic back pain.
Yes.
This stressful lifestyle is a factor which leads to chronification of the pain. Once the pain becomes chronic, we cannot manage with the simple methods. Even surgery alone may not be helpful in managing chronic pain. So in such cases, we will have to go for a multi-factor or a team approach to deal with back pain, where we have to do surgery, physical therapy, occupational therapy, medicines, and including psychological counseling and psychiatric support to reduce the stress, and if they have any other problems, to manage that also. So avoiding stress and being relaxed is also a way of preventing back pain.
So excessive stress also increases
the chance of back pain.
Okay. So doctor, what is the prognosis of low back pain?
As I said, it is a very common condition, and most of the backaches are self-limiting. They will resolve on its own. You will feel some discomfort in between, which can be managed by the methods I have mentioned. And I feel that because more than 90% of people recover on their own, given a little bit of time and patience, and as long as you maintain a positive outlook without being stressed or panicked about it, I think the prognosis is very good. It's not my thought alone. Evidence also shows that most of the back pain will resolve. People need not worry too much about it, provided they give concern to the danger signs and seek medical help early in the stage. Most of these backaches will recover. It's a very good prognosis.
So doctor, you have described everything in detail. Any advice from your side for our viewers on this topic or any other topic related to healthy lifestyle?
Related to healthy lifestyle, it's as I mentioned before, everything boils down to becoming physically fit, doing exercise, maintaining a good diet, avoiding gaining excessive weight, avoid smoking and alcohol. And these are common things which helps us in preventing many diseases, not only backache. Many diseases can be prevented by these simple measures. And the best thing is that we don't need any paid service to many. We only need to be motivated to do these activities, and it will help. And another point I want to give to the audience is to never ignore simple things also. Even if I said backache is simple, most of them recover. I have also mentioned some certain danger signs, and if you are aware of certain danger signs, or if you have any little bit, seek medical attention and evaluation as soon as possible, so that it will not progress into we do not need to fear any medical procedure or medication, because we have evidence for all these things, years of evidence and practical experience with these things. So, need not fear seeking treatment and undergoing treatment, because ultimately you will be benefited by that. Every member of the audience will be benefited by that. Okay. So, thank you, Jessica.
Thank you, doctor. Thank you for being with us and giving us a lot of valuable information about low back pain. This is a very common condition now, and everyone will be benefited with your talk, I am sure.
Okay. To summarize what we have mentioned here now is that low backache is a very common problem faced by which will be faced, or many people are facing right now. We have mentioned the various common causes of backache and the types of backache. We have mentioned the ways to prevent backaches, and we have mentioned the common investigations we do to find out the cause of backache, and the common treatments and certain misconceptions regarding the treatments we have cleared. Another thing, we have mentioned the other causes of backache which are not related to the spine. So, in short, I think this was a very fruitful discussion, and I hope many people will benefit from this, and many people will be motivated to lead a healthy lifestyle, to abandon smoking or alcohol, or to reduce their weight, to exercise daily. And I hope this program will bring more information to the public, and I thank BMC for providing such a service to the general public, and all the best.
Okay, thank you, doctor. Thank you for being with us and giving us a lot of valuable information about the low back pain and also about a healthy lifestyle, and I am sure the viewers would be benefited with this.
Thank you, Jessica.
Thank you once again. So viewers, as doctor said, sedentary life is the main reason for the low backache. So maintain your body weight, exercise more, stay happy, stay healthy. This is Jessica Mujib signing off. Good night.